Still reeling from his third failed attempt to abolish the Affordable Care Act with a Republican-controlled Senate, Donald Trump made his most aggressive move yet by threatening to stop billions of dollars in government subsidies to insurers. Yesterday, Trump signed an executive order that would offer cheaper health insurance plans with less coverage and fewer protections and allow small businesses to band together to buy insurance across state lines. But late last night, the White House acknowledged they also plan to scrap the ACA's long-contested subsidies, which health insurance companies say they need to help pay out-of-pocket costs of low-income people.
It directs the Department of Health and Human Services, the Treasury, and the Department of Labor to take action to increase competition, increase choice, and increase access to lower-priced, high-quality health care options. And they will have so many options. This will cost the United States government virtually nothing, and people will have great, great health care. And when I say people, I mean by the millions and millions.
Now, the move comes just weeks before the ACA's open enrollment begins. If insurance companies do not get those payments, the Congressional Budget Office says premiums would rise by 20% next year. The White House put out this statement. The bailout of insurance companies through these unlawful payments is yet another example of how the previous administration abused taxpayer dollars and skirted the law to prop up a broken system. Congress needs to repeal and replace the disastrous Obamacare law and provide real relief to the American people. Democrats are outraged. Senate Minority Leader Chuck Schumer tweeted last night, and I quote, "It is a spiteful act of vast, pointless sabotage leveled at working families and the middle class in America, in every corner of America." Let me go to our panel today. Barbara Arnwine, founding president of Transformative Justice Coalition, Brandon Cooper, chairman of the Prince George's County Republican Party, and Amber J. Phillips, co-host of Black Joy Mixtape podcast. So good morning, everyone.
Good morning.
Good morning. I don't even know where to begin. I guess we're just going to keep going and going and going until we can find a way to get rid of the Affordable Care Act. One of the first things that strikes me is, how is this not going to cost the American public anything?
Of course it's going to cost the American public, and it's going to cost a lot of individuals their health care, their lives, their best health. This is one of the most vicious things this administration has done. And I think that, we already knew this was an elitist-oriented administration that only cares about the upper class, the rich. But now they have directly attacked the poor.
And what I don't understand is it is the poor that overwhelmingly voted for Donald Trump, the quote-unquote forgotten man, the part of white America that feels disillusioned, feels like the government has left them behind. If you go back and you look at all of these YouTube videos, for example, of constituents in Republican congressional districts saying, you're going to kill my husband, you're going to kill my wife, you're going to kill my child, we have to have health insurance. Brandon, what's the strategy here?
Yeah.
What's the re-election strategy if you're taking away health insurance from the very people who voted you into office?
Right. The strategy, I think, as we all clear, is kind of mute. Is confusing, to say the least. But I hate this idea that there's only two dichotomies. Either you love Trump or you hate Trump. I happen to be not in either of those positions. I'm in the middle. This issue of...
You can find something to like about him?
I love to be able to get like 20 seconds of my thought out.
Okay.
I love the panel today. I know, I love it. I'm on a panel of beautiful ladies today. But so my point is this. There are 28 million people right now who do not have coverage of Obamacare, and so let's stop pretending like everything with Obamacare is perfect. You heard Bill Clinton last year during the campaign said there's anything to be fixed with Obamacare. So I don't agree with
makes it worse.
Let me finish. I don't agree with the whole let's repeal everything, replace. I feel like that strategy is failing, but there are parts of Obamacare that are broken. This is another Democrats agree.
Let
me go back. So this subsidy has already been deemed unconstitutional by the lower courts. It's going to go away because it's already been deemed unconstitutional. Right now it's on appeal. It's at D.C. Circuit Court, but it's already been deemed unconstitutional because the way it's done, Congress is supposed to provide funding. It wasn't provided that way. So that's one thing with that. But also, let's look at the other things that he's done. He's also done yesterday. And again, I'm not in favor of all that he's done. But in addition to what you guys are talking about right now, the subsidies, there was also the move to allow those 28 million people who don't have health insurance, most of those people are low-wage workers with restaurants, allowing them to come together like the big corporations do.
Instead of allowing the employers.
Exactly. So that's something that's needed. I mean, we're allowed to buy across state lines. So I think over yesterday's statement, there was something that I think you can take on both sides of it if you look at the full issue and not, always in the political lens that we do sometimes.
As we continue to say, there is no replacement measure here. Lots of us remember before Obama was in office, the videos of people in packing emergency rooms. And when we talk about this is affecting the poor, let's be very clear. Our idea of what poor is very false.
Yes.
It moves around. The majority of Americans, regardless of income, unless you are a billionaire like Donald Trump, the majority of Americans cannot afford their health care bills, especially when it's an emergency, especially when we talk about cancer, which the government is also helping to support by not having environmental protections in place,
8 years
by
after
not
Obama.
having.
It still can't afford.
No.
I'm agreeing with you.
So,
I'm agreeing with you.
But what I'm saying is Obamacare takes us in a step to address that.
Some parts of it do, I agree.
Even having health care at $200 a month or whatever your monthly fee is better than having no health care. By having Obamacare in place, it gives us a starting place to make it better. If Trump or any of the Republicans cared about that, they would have spent the 8 years trying to improve Obamacare instead of just repealing
I agree.
it,
Well,
which
I
never
I
happened.
agree.
Ultimately, the answer to all of this is November 6, 2018. That's the answer.
And I will tell you,
November
Justice John
6th,
Roberts
2018.
has surprised us repeatedly on the Supreme Court. I think if
Yes.
it goes to the Supreme Court, I don't think it's going to be deemed unconstitutional. I think the lower courts are wrong.
either.
I think it's going to be found
the public has
constitutional.
healthcare.
And I
The
think
public wants
Justice,
healthcare.
the public
Totally
wants health care,
agree
but
with
more
you.
than that, I think Justice John Roberts is going to surprise the Trump administration just as he's surprised everyone else, and it's going to be found constitutional.
Absolutely.
Weekdays on TV One.
I will never lie to you.
Oh my God.
Roland Martin.
He doesn't want to talk to us. He wants to ignore us.
Uncensored.
Hell no. That ain't gonna cut it, boo.
Unapologetic.
No, that is fundamentally false. You are wrong. He
Unfiltered.
wants an America where we all look alike. He ain't talking about black people.
Unrelenting.
You better go work out, because you got a fight on your hands.
NewsOne Now with Roland Martin. Weekdays at 7 a.m. on TV One.